New hope in the treatment of multiple sclerosis. Promising results of stem cell therapy. An international team of researchers has shown that injecting a type of stem cells into the brains of patients with progressive multiple sclerosis is safe, well tolerated, and has a long-lasting effect that appears to protect the brain from further damage. The study was conducted in a small group, but it illustrates the potential of treating this disease with stem cell therapy. Multiple sclerosis, MS, is an autoimmune disease in which the immune system attacks cells of its own nervous system. This results in incorrect transmission of nerve impulses. This happens because the immune system destroys the myelin sheath of neurons. As the second part of the name of the disease indicates, disseminated, the disease process is scattered in various places of the nervous system, in the brain or spinal cord. MS is not an inherited disease, but there may be some genetic predisposition to developing the disease. MS is usually diagnosed between the ages of 20 and 40. The disease can manifest itself in various ways, including through movement, sensation, vision disorders, cognitive disorders, or mood disorders. It leads to disability, although if detected early and treated well, it may have a mild course. More than 2 million people live with multiple sclerosis worldwide, and although there are treatments that can reduce the severity of the disease, 2/3 of patients progress to a devastating form of the disease called secondary progressive multiple sclerosis within 25 to 30 years of diagnosis. Unfortunately, there are few treatments for this form of the disease. In the new work, scientists from the University of Cambridge, the University of Colorado, the University of Milan Bicocca and the Hospital Casa Sollievo della Sofferenza in Italy used stem cells. The study involved a small group of people, but it showed that administering stem cells to the brain can help stop the progression of the disease. The description and results of the research were published in the journal, Cell Stem Cell. The publication in Cell Stem Cell followed early human studies. 15 people with secondary progressive multiple sclerosis took part. They all had neural stem cells, NSCs, injected into their brains. In previous research, Cambridge scientists showed in mice that skin cells reprogrammed into brain stem cells transplanted into the central nervous system could help reduce inflammation and repair damage caused by multiple sclerosis. The new research is a continuation of research on rodents. After the injection, the research team followed the patients for 12 months. The therapy turned out to be safe. The researchers observed no serious adverse events. Although some side effects were observed, all were temporary, flu-like symptoms and respiratory infections. At the beginning of the study, all patients had some degree of disability resulting from the progression of the disease. Most required a wheelchair, for example. Over the 12-month follow-up period, none showed an increase in disability or worsening of symptoms. Some patients were also assessed for changes in brain tissue volume related to disease progression. The researchers noticed that the higher the dose of injected stem cells, the smaller the reduction in brain volume over time. They speculate that this may be due to the fact that stem cell transplantation reduces inflammation. Scientists also looked for signs that the stem cells given to patients were neuroprotective, meaning they protected nerve cells from further damage. They looked at changes in brain metabolism after treatment. They examined cerebral fluid and blood and saw some changes related to the way the brain processes fatty acids. These symptoms have been linked to the effectiveness of treatment and the development of the disease. The higher the dose of stem cells, the higher the level of fatty acids, which also persisted for 12 months. Most importantly, patients did not report significant declines in movement or cognitive function during the study, as would be expected in the absence of treatment. We desperately need to develop new treatments for secondary progressive multiple sclerosis. I am cautious but also very excited about our findings, which represent a step towards developing cell therapy for the treatment of multiple sclerosis, said Stefano Pluchino from the University of Cambridge. We realize that our work has limitations. It was only a small study, but the fact that our treatment was safe and that its effects lasted for 12 months means that we can proceed to the next stage of clinical trials, he added. The NSCs injected into patients were obtained from cells taken from brain tissue from an aborted fetus. The Italian team has previously shown that it would be possible to produce a virtually unlimited number of these stem cells. And in the future it will be possible to collect these cells directly from the patient. In the study, researchers tested 4 different doses of NSC in combination with drugs that suppress the immune system. Although these findings are promising, caution should be exercised given that they were obtained in a small group of patients who were additionally receiving immunosuppressive drugs. However, this study provides the first convincing evidence that a single injection of stem cells directly into the brain is safe and may have long-lasting effects in people with secondary progressive multiple sclerosis. Further research is needed to confirm and extend these findings. But this work provides promising indications that this approach may become a valuable therapeutic option in the treatment of advanced stages of multiple sclerosis.